Now, as we know, the spermatic cord is the main content of the inguinal canal along with the ilioinguinal nerve, which is a partial content. And the spermatic cord, it is going to pass through the deep inguinal ring and coming out from the superficial inguinal ring. So here in this figure, let's orient the deepest layer which is present in this figure. It is the parietal peritoneum. Just superficial to it, we find the extraperitoneal connective tissue. Just superficial to it, we find important fascia, that is the fascia transversalis. And within this fascia transversalis, we find this deep inguinal ring through which spermatic cord is going to pass. While the spermatic cord is going to pass through this deep inguinal ring and enter into the inguinal canal, it carries one fascia, and that fascia, it is going to cover the innermost side of the spermatic cord, and this fascia, it is called as the internal spermatic fascia. So internal spermatic fascia, it is the part of the fascia transversalis. Just superficial to the fascia transversalis, we find the transversus abdominis muscle, and just superficial to it, we find the internal oblique muscle. And both these muscles, they are going to form the conjoint tendon, which is going to form the posterior wall of the inguinal canal. And while this spermatic cord, it passes through the inguinal canal, this internal oblique muscle, it provides some muscular fibers to the spermatic cord, and these muscular fibers, they are called as the cremaster muscle. So here in this figure, we have shown the cremaster muscle present here. And the most superficial muscle which is present just in front of the internal oblique, this is the external oblique with its aponeurosis. This aponeurosis of the external oblique having one gap within it, and this gap, it is called as the superficial inguinal ring. While the spermatic cord, which is already having two coverings, one from the fascia transversalis, that is internal spermatic fascia, and another from the internal oblique muscle, that is the cremaster muscle covering. And along with the cremaster muscle, it also having the cremasteric fascia. So other than these two coverings, when this spermatic cord passes through the superficial inguinal ring, it also carries this additional covering, and this is the most external covering, and that's why it is called as the external spermatic fascia. And this external spermatic fascia, it is going to reach up to the scrotum along with the testes. So at the end, we can say that when the spermatic cord, it passes through the deep inguinal ring to the superficial inguinal ring, it is going to be covered by the three fascias or the three coverings, one from the fascia transversalis, that is internal spermatic fascia, one from the internal oblique, that is the cremaster muscle and cremaster fascia, and one from the external oblique aponeurosis, that is the external spermatic fascia. Now, after having this detailed anatomy of the inguinal canal, now we can understand that this inguinal canal, it is the fibromuscular tunnel which is present between the deep inguinal ring, which is situated deeply, and the superficial inguinal ring, which is present in the superficial aspect. Because of this space within this inguinal canal, the abdominal contents, they are more prone to get travel through this deep inguinal ring to the superficial inguinal ring after passing through the inguinal canal, and this is called as herniation. So hernia is nothing but it is the abnormal protrusion of any content through the wall of the abdomen, and this type of hernia where the abdominal content are passes from the deep inguinal ring to the superficial inguinal ring and herniate from the superficial inguinal ring. This type of hernia, it is called as indirect inguinal hernia. But nature provide few defense mechanisms for the prevention of such herniation in normal condition, and these defense mechanisms, they include the flap valve mechanism. As this inguinal canal is oblique in direction, as we already know, this deep inguinal ring it is situated deeply, and the superficial inguinal ring is present superficially. So because of the different location of this deep and the superficial inguinal ring, when the intra-abdominal pressure it increases, the anterior and the posterior walls they are getting obliterated with each other, and this mechanism it is called as the flap valve mechanism. Second defensive mechanism of the inguinal canal it is the guarding mechanism. In the inguinal canal, this deep inguinal ring it is supported anteriorly by the internal oblique muscle, while the superficial inguinal ring it is posteriorly supported by the conjoint tendon. It is also made up of the internal oblique muscle as well as the transverse abdominis muscle. So because of the contraction of the internal oblique muscle, this this deep inguinal ring and the superficial inguinal ring they are guarded by the same muscle, and that's why this mechanism it prevents the herniation of the abdominal content through the inguinal canal. The third mechanism it is the Sutter mechanism. As we already know that the internal oblique muscle it is responsible for formation of the anterior wall, roof as well as the posterior wall of the inguinal canal. So at the time of the contraction of the internal oblique muscle, the roof and the floor of the inguinal canal they are getting obliterated by each other, and that will prevent the herniation of the abdominal content through the inguinal canal, and this mechanism it is called as the Sutter mechanism. The fourth defensive mechanism of the inguinal canal it is the ball valve mechanism. As in case of the male, the cremaster muscle is present, and which is the extension of the internal oblique muscle. So when the contraction of the anterior abdominal wall and mainly internal oblique muscle is there, that will also lead to the contraction of the cremaster muscle, and because of the contraction of the cremaster muscle the testis it is going to pull upward, and that is going to plug the superficial inguinal ring, and this mechanism prevents the herniation of the abdominal content through the superficial inguinal ring, and this mechanism it is called as the ball valve mechanism. The next defensive mechanism it is the slit valve mechanism. In case of the superficial inguinal ring it has two crura, one lateral and one medial crura, and the contraction of the external oblique muscle it will lead to the approximation of both these crura, and this will lead to the prevention of the herniation through the superficial inguinal ring, and this mechanism it is called as the slit valve mechanism. So all these are the defensive mechanisms for the prevention of the herniation of the abdominal content through the inguinal canal.